Hey guys, I'm Sebastian. This is Dom. We are the locally world famous chiropractors in Huntington Beach, that's in Orange County. Well, so anyways, we're going to cover some cool stuff today that you guys are hopefully going to get a lot of information about your lower back and SI. Can you go ahead? I'll show. So right around here, so you're going to have like back pain right around here, and a lot of times people don't know if it's the SI joint. She's just like coddling this.
I'm giving it. I'm putting its natural curvatures back into what it needs because it was like this.
I thought you just looked like you were just kneading dough or something, like you were in Ghost.
It's kind of
You're just really with it.
Yeah.
So we're going to show how you can figure out beyond reasonable doubt, at least if you're dealing with an SI joint issue or if you're looking at actually like a low back disc. Because the hardest thing for a lot of people seems to be, what is my right diagnosis? I can't do anything until I start or until I know my right diagnosis. Granted, it is to know your right diagnosis, but a lot of times the remedy is fairly close to the same in that area. So we just want to give you guys at least some beyond reasonable doubt. By the way, if you're in Huntington, come see us. What do you want to cover first on the SI joint versus low back?
I think we should just tell them what's what first.
Okay. By the way, later we will go over some tests. So Dom's going to show you what the SI joint and low back disc are.
Yeah. So SI joint, so you have your sacrum, which is the S, ilium, which is the I, and then the joint in between is the SI joint, okay? Your discs are in the spine. You have your vertebra, and you have your discs in between. And so if you look at like the bottom one here, and the location of it, it's very close to this one as well. So that's why we're going to go through just some differentiating things for those two areas.
Apparently the fire department thought this is a really interesting topic. We're going to come over there too. So
did I just go through the parking lot? I didn't even notice it.
No, they were they were like right there. It was
okay.
Probably loud enough. Okay, so some of the tests at least, go ahead and line your back. We're going to show you some that we use in our clinic at least for the SI. We're not going to go over all of them.
Try these at home, by the way.
Yeah, line your back.
On my back.
Yeah. So first is anything, we just kind of contact the sides and just push in a little bit. The reason why we're doing something like this, at least I'll show you in the model, is that to really figure out if we're irritating the SI joint, we're trying to put some force through it to create some shear, because the SI joint doesn't really love a lot of shear. So I'm just using other parts of the ilium to push and shear the area.
So he's taking those like pokey parts of my hips right here that everybody can feel and just pushed on them.
Yep, pushing the pokey hips. So that's one. Okay. Another might be slide the leg off the side, let it kind of dangle there. And so you're going to grab this right there and just go ahead and pull up. It's important not to round your back when you do so, because then you're coupling in like a disc test. And so if her back's flat on the table and just doing something like this, and especially providing some overpressure, bothers her, then we might be looking at a little bit more of an SI joint shear problem versus actually just having a disc. Last one is go ahead and lay on your side. In school we called this pelvic rock because I imagine like playing a guitar, but it was just going like this.
Yep.
Okay, and so a lot of times, again, this will shear the SI joint, and if it irritates it in that same vicinity, then yes, we could have a problem there. However, with SI joint stuff, really there's a cluster of about 5 tests that we do, that you want to see about 3 positive. Honestly, we don't see a lot of people that have it. It's rarer to find that than it is disc. Discs are very common. So Don, why don't you show me, I'll be the demo for the disc stuff.
Okay.
Okay. What do
Stand
you
up
want me
for
to
me.
do? Stand?
Touch your toes.
Oh, I'll go back here so the camera can see. Okay.
Touch your toes for me. How does that feel?
Ow.
Where?
Right here, and a
Okay.
little bit into here.
And notice that we're collecting data. Just because one thing hurts doesn't necessarily mean it's that thing. It's got to be a multitude of things that we track. So.
The doc, it's right here. It's on my SI joint.
Okay, so then let's do some more disc stuff. Let's test out some more disc. Let's have you sit. Okay, round for me.
I'll go this way.
Can you see in that one? Good. Actually, I want you to scoot up on the table a little bit.
Still got room on that
So
camera?
just sit in a really poopy posture
Poopy.
and grab underneath the sides of the table for me. Pull yourself into it. What does that do?
Ow.
What does it hurt?
Hurts my back and my SI joint.
Sit up for me. Pull yourself in.
That's better.
Okay. So
What's that
the only
mean?
thing we changed was the low back. We didn't change the position of the SI joint at all. And so I think about the fact that we put pressure more on the disc to recreate that pain.
Mm. You know, what about, I'm just curious, what about my piriformis muscle? Because it hurts during that too.
While doing this,
Yeah.
we're not doing anything to the piriformis when we're in this position. And so if it creates your piriformis pain, it's probably a referral from your disc or nerve into that area.
So
I
also,
forgot we were talking to a camera for a second. I thought I was teaching you.
so the I think a part too that I know that a lot of people say that at least with piriformis, and it's a common discussion based upon the region. So I thought it'd be included, is that they say, well, it hurts to sit on it. That's the piriformis muscle. I know it hurts, and so we're still putting pressure on it here versus here. It's the same pressure. So why does one hurt and one doesn't? The only thing it changes is the lower back, right? And so that would be an indication that it's not the piriformis either. What else do we have for disc?
Would you like a sit up?
Sit up, okay. We gotta include that sneezy. Let's see. Ow!
Disc! Just kidding, not necessarily. But if a cluster of these exams are all recreating that pain, all of these disc ones, we should probably cue in a little bit more on the disc than anything. What about coughing, sneezing, bearing down?
Those don't always hurt. Sometimes when I sneeze, when I'm really trying to project it downward, scaring the
Show
cat.
the camera what you mean by that.
Okay, so if I'm sneezing and I'm just kind of going down, like I'm trying to hit my elbow, like cover my cough, that really hurts.
So we'll notice the low back rounding when that's happening. Seb tries to give his people to sneeze in the air.
Yeah, I want him to what does LeBron do?
Yeah.
I want to do that.
Okay. See if that helps with your disc pain is what he's saying. Sneezing up rather than sneezing down.
Yeah.
And see if that works.
And probably another important part too with at least the SI joint is a lot of times you notice that a lot of them are split stance. So it's the stance of the legs here that will create a lot more shear versus just a round. So the round can happen in any stance of
So you're
the
telling
feet.
them to get into that position and that be another test?
That might be it might
Or
be
like
a
squat?
Yeah, you can do the split squat. So it might be a little bit more of a test. Again, this is not a standard test, but usually walking it hurts a lot more with SI joints than it would with a disc. Disc can certainly hurt with walking, but usually they'll start to settle themselves after about the first 10 to 20 steps. It'll tend to get better versus getting worse. So that is basically it. We're going to cover in some of the other videos coming up ways that you can, exercises you can do and stretches you can do to help out with both. If by chance you don't see it on the side and that this has already been published, just go to our channel and just search it. So you can search SI joint. Our channel is going to be, I think it's below on YouTube. I don't know where it is on mobile. I think you got to scroll all the way down maybe, but it'll say Performance Place. And just click on it and just go through, and you'll go through a search function on our channel. You can type up low back disc. That's D-I-S-C, not K. Is it? I've seen K a lot.
When people are talking about those discs?
Yeah.
Oh, I've never seen that before.
I've seen it, but it's C. Anyways, or put in SI joint, and you'll have more information than what you'll ever want. So just subscribe to our channel. It's in the corner somewhere. And we look forward to seeing you later this week or next week. We don't know yet.